Good evening. Welcome to Let's Talk DMV. I am your host, Dr. Reggie Ratliff. And for those of you who are tuning in outside the DMV, DMV stands for District of Columbia, Maryland, and Virginia, the DMV region. And so we are welcoming those who are tuning in from outside the DMV. I'd like to thank you for tuning in tonight. And joining me right now at this moment is my co-facilitator, Go Laborer in the Vineyard, and investment advisor, Terrence Hollingsworth. Terry, are you there?
I am. How's everybody doing? How are you, Dr. Ratliff?
Right, brother. It was a good day. How you feel?
Good.
Good, good.
Outside of my puffy eyes, I think we're gonna be all right.
Hey man, it's that time of year, man. I mean, summer is officially coming to an end. These leaves are starting to hit. I'm sure it's out there in Iowa as it is out here with the allergies and stuff. First thing it hits
Yes,
is the
sir.
eyes. Hit the eyes. You know,
Yeah, if I had some dark sunglasses, I would just put them on and then we would be straight. But we're
but you
gonna
cool.
make it through. That's all.
Yes, sir. Yes, sir. So, there's a lot going on in our world today. And, I just want to talk about just for a moment our discussion on our master financial investment class on Thursday, something that's been a hot topic for a while.
Yeah, so it's funny you say hot topic, and most of what we're dealing with is what? Inflation. And
Yes, sir.
so with inflation, what we're seeing the market go down, and every day, it seems to go lower. Then it gets a rally for a few minutes, and then it's down again. And so one of the questions that someone asked in class last week was, when do I sell? And so we'll spend some time talking about that because, um, we always talk about how to win and when you're making a lot of money, but
Mm-hmm.
most of us have never gone through a prolonged down market, and we are here. Inflation is not going away today or tomorrow. It's going to go into 2023. And I've heard some people say we may even go into 2024 with inflation and high interest rates. So it's a perfect conversation about, yeah, we're buying, but when do we decide to take some profit, or when do we figure out that something's not working and we just take a loss on it? So,
You say something that reminds those who participate in our discussion, Terry, about two people holding the same stock. And,
mhm.
just touch on that because that also goes towards whether to sell or hold. What do you say about the two different people holding the same stock?
So I have a saying, and it is two people can own the same stock. One could be buying more, the other one could be selling, and they both can be right because everybody's journey in the stock market is different. And it's one of the reasons why I have a little bit of a problem with, a lot of advisors will use a software, and the older you get, the more conservative it'll place your portfolio. But the reality is we have to adjust our portfolio for what the market says. The market drives returns, not how we feel about the market, not our age or anything like that. And so, again, two people can own the same stock. One could be buying more, the other one could be selling. They can both be right about their strategy. Come find out why that is the case.
Absolutely. Join us on this Thursday at 5:30 p.m. Central Standard Time, 6:30 Eastern Standard Time. If you're interested, which I hope you are, in joining our discussion on Thursday, you can email me at sratliff68@yahoo.com. Just express that you would like to participate in the discussion on Thursday. In turn, I will respond with a link to access the class. It's a virtual class, it's a free class, it's a necessary class, and it's going on through Zoom. So we look forward to you joining us. And I'll just add this for free. It's rare that you'll speak with an investment advisor who's qualified to give investment advice like Terrence for free. So you have free initial consultations, but then after that, they start charging. Terry is offering his free time week after week after week, no charge. So take advantage of this opportunity and join us on Thursday. We look forward to having you.
Yeah, before we go, I'd like to address that.
Yes, sir.
I grew up in a modest household, and like most of us,
Mm-hmm.
my parents took their cue from the church.
Right.
Of course, I went to school, and neither one of those institutions prepared me for what I've done for the last 20 years.
Mm.
And so, I like doing these classes because I know there are hundreds of thousands of people that they're going to school, they're not getting any real financial education, or at least they're not linking the education to the curriculum. They're at church and they're faithful, and yet sometimes, most times they're just not getting the information how to build wealth. And so
Mhm.
I'm committed to always talking to people about this. I think it's necessary, and I hope you join us.
Look forward to it. Well said, Terry. And by the way, you have been an asset to this program. As far as our master financial investment class, week after week, brother. And I definitely appreciate you. To those who participate every week, they definitely appreciate you. And we really have fruitful conversations that, especially our people, need to take
Yeah,
advantage.
without doubt.
Our people
Yeah.
need to take advantage of this opportunity. So, we hope that we get more response in turn after this podcast. So. Thank you, my brothers, always.
All right.
Um,
I will see you later. Hopefully, I'll see you all Thursday.
all right. So I'm excited about introducing our guest. She is Mrs. Latrice White. She's a Northern Virginia native, born and raised in Fairfax County. Um, Mrs. White has served in various local ERs from Richmond County, that's Richmond, Virginia County Community Hospital, all the way north as far as Inova in Loudoun County. She's been a registered nurse for 15 years, working in settings from the emergency room to pre-op to post anesthesia care, which is also known as PACU, to marketing and health screenings. Mrs. White has three children, aged 12, 6, and 3. She attended Hayfield High School in Fairfax County, George Mason University for her undergraduate studies in nursing, and she is currently pursuing a doctorate in nursing practice that's also known as a DMP, scheduled to finish in May of 2023. Her journey has been very well rounded, and we're happy to have her. Please welcome Mrs. Latrice White. How
Thanks
you
for
doing?
having me.
How are you this evening?
I'm wonderful. I have
Good.
no complaints today.
Well, I want to start off by thanking you for your service to, you know, um, population as far as care during these challenging times. I know you was in the thick of the pandemic when it first hit, in March of 2020, and everybody was visiting emergency rooms and things like that. So to you and all the other nurses out there, I just want to thank you all for your service.
Thank you. Yes, you're right. I was in the midst of the pandemic. It was a challenging time for nursing in general. I fortunately was not in the emergency room at that time. I
Mm,
was working in the urgent care, but it was no different. It was still the same chaos everywhere.
mm. So I'm sure you saw a lot um, of those who were trying to just survive, and those who had passed on. I'm sure that was some emotional times for you, was it not?
Oh yeah, when the pandemic hit, healthcare was not immune to being caught by surprise when it came to the pandemic. Just like everybody else in the general population was kind of like at a loss for information, healthcare was really no different. We were still navigating the challenges of what do we do next,
Mhm.
right along with the general population. So when everybody else was out there looking at healthcare professionals like, the answer, in reality, we were just the same as everybody else. There were a lot of answers we didn't know. We knew a
Um,
lot about how viruses work in the body. We know how to take care of people, but there was still a lot of unknown with COVID in general.
when Donald Trump was in office, which is when the pandemic hit, he was reluctant to, shut things down and to take a step back. I remember he said there'd be like a miracle. It's only 2 or 3 people who has this illness, but everything will be okay. But when it wasn't okay, panic set in. What was going on in your field? Was it a lot of meetings? Was it panic amongst you and your colleagues and those that where you were employed at that time? Like what was that mindset?
I think a lot of the dysfunction with the way the pandemic was handled in healthcare was just like total disbelief. Like, how can you be on TV talking about, it's just like the flu or it's just a simple cold? Like you're pacifying this issue as if we don't see people in here dying or we don't see people in here struggling, even if people weren't dying of COVID. And there was a time when, you know, they assumed COVID was just like the regular flu in the beginning. However, it was unknown. There was a lot of things just were not known. And he was making it seem like he had all the answers when in reality, we're seeing people struggle to breathe. And you're sitting here saying that just a simple cold. It was dismissive. And it
Mhm.
was infuriating because the people who believe him will come into urgent care and they're coughing and hacking all over everybody and saying, oh, I don't need a mask. Oh, it's not that serious. I don't need a mask. Like the
Mm.
level of I don't need evidence to prove what I'm saying was unbelievable.
Right, right, because you were right there, like
Yeah.
right there.
And it's,
Yeah.
I mean, it's sad because family members,
Mm.
I think a lot of times family members look at us as healthcare providers as, you know, what should I do? I want to believe what the media is telling me about COVID, but
Mhm.
I have a family member that's laid up in hospital, intubated. So who
Mm.
am I believing? You're going to believe the person that's seeing their family member struggle versus somebody who is at the White House giving speeches all day long. Like he
Right.
doesn't, he's very removed from the situation, but he's the authority at the time. He was the authority giving people the information that they needed to know.
Right. Yeah, and I know there was a big debate of whether this is real or not, but then when Maryland shut down and DC shut down, Virginia shut down, then everything started to break loose. And there's definitely a disconnect between the government and the people on the ground, such as yourself and some of us who also are family members of those who are in the medical field. So, like my brother's in the medical field. Terrence, he has a family member in the medical field who are RNs and things like that. So, do you agree that there's a disconnect between government and what you do on the ground?
Oh, for sure. There's a an already known mistrust of Black people and the government. When you mix healthcare in the mix of it, it's even more amplified. Black people already have a mistrust of providers in general. For a provider to come and say, "Oh, take this vaccine that we just created and somebody's, we just created last week," there's a lot of, "Oh,
Mm-hmm.
I
Mm-hmm.
don't know about that." And as a provider, people are looking at me like, "Oh, you're going to get this vaccine?" And I'm looking back like, "Y'all can go ahead and get that vaccine." And in the beginning, I'm not going to lie, there was a lot of hesitation. I had
Mm-hmm.
to read a lot about the vaccine. I had to read a lot about why we were doing this, what's the end result, where this came from. I did a lot of my own research before I was like, "Okay, I'm going to do this." And
Mm-hmm.
it's because I don't mistrust the government or mistrust healthcare any less or any more because I'm a provider. I'm just more educated in what they're saying to us.
Right.
I can understand a little bit more than maybe the average person, but the level of distrust is still the same. I still know what they did to people, and it was not that long ago. They only
Right.
started even measuring the effects of how healthcare has affected Black people since like 1956. So, you know,
Yeah.
we're not really that far removed from distrusting the government and distrusting healthcare in general. So to mix those two and make it a mandated vaccine that many people were mandated to get, I
Mm-hmm.
understand the apprehension that most people have with getting the vaccine.
Do you agree that, a lot of Black people were referring back to the Tuskegee experiment? What was happening back then with the Tuskegee Airmen and those who were impacted in, not Tuscaloosa, but Tuskegee, Alabama, um, as far as going as far back as far as the mistrust?
Oh, for sure. I think that is one of the instances that are very well known and very documented. But outside of the mistrust from military members in regards to healthcare, the only reason that medical science knows what they know about obstetric care is because of work that male white providers did on Black female women during their laboring years. When they were trying to study women's health,
Mm-hmm.
that meant there was a lot of experimentation done on Black females. That experimentation on Black females is not something that's widely discussed, but that doesn't mean that it's not known. It's not known. It's known because it's generationally passed down from women. It's known because there are a lot of women who have been in science and healthcare for many years, and they know those things have happened. They know not too long ago those things were readily accepted and happening to women as late as even the early 70s. So it's not like Tuskegee was the only example of science misusing and you know going against what they are promised to do to everybody to just Black people. That is
Right.
something that has been going on since before Tuskegee. Tuskegee highlighted it, but it
Mhm.
was still happening to women every day giving birth in these teaching hospitals where they're not really properly managed or cared for in the ways that they want everybody else to be cared for.
What do you see as your role as a nurse, and particularly someone who is reaching towards that terminal degree or certification as a doctorate in nursing practice? And there's a reason why you're pursuing something that high. What are your goals? What is your vision once you achieve that?
So I was in school studying to be just a master's prepared nurse practitioner because I wanted to just be able to work a little bit more independently. That was my original goal. As I did more research and I had an assignment that was geared towards like population health. So I'm doing research and I came across a statistic that's really stuck out to me. And I was reading a study that was done from the like various departments of health in Northern Virginia. They came together to figure out what needed to be done to help strengthen our community. And one of the statistics said that a child born in Dumfries has a 7-year less life expectancy from a child born in Montclair. So
Wow.
if you're not familiar with that area, Dumfries and Montclair, the difference in that area or zip code is like less than 1 mile. Less than 1 mile. And this is a county and an area that's 20 miles from the District of Columbia. Like
Hmm.
it's right down the street.
Right.
We have in this area, if you don't know the DMV, it's not a statistically known as a low income area. Like we have people who are making very good money. There are a lot of government workers in the area. There's multiple military bases. Like this is not a poor area by any stretch of the means. So
Mhm.
to see a life expectancy of a child to be 7 years less because of your zip code, to me, that really spoke to like what is going on in this area, that is how we have gathered all this data and this is what it's telling us. And that's what pushed me to pursue this DMP is because that's a problem. And there's not enough to be done. There's not enough being done to figure out why this is still a problem or why there's a 7-year difference in life expectancy from birth for a child just because they're black in an area where there's more black people versus more white people. Like that was a real problem for me. And I think one of my goals in seeking my DMP was that I want to figure out and I want to be able to help more black people live longer lives, and not only longer lives but also live lives that are fulfilling. You know, people kind of sometimes neglect how important their health is, even though their health affects literally every aspect of your life. And for me, that was the focus of my DMP is that I want to be able to help people optimize their health in ways that I don't think the current healthcare system is really doing enough to kind of push forward. My project with getting my DMP is focusing on Black health and how we can better manage hypertension in the Black community because it's significant. It's significant and and it should be alarming to everybody that when it comes to how Black people are taking care of themselves and how health care systems are helping Black people take care of themselves, we're faltering. And because the healthcare system is faltering, we have the worst outcomes of every nationality across the board. And that's scary to me because I have little kids
Mhm.
and I don't want them to be told the same thing my parents and my other loved ones have been told, which is those are just Black people diseases. You have hypertension because it's a Black people disease, or you got the sugar because
Right.
it's
In
Black
the blood.
people.
Yeah. Yeah.
That's not what it is. And that's not what, and even if that was the situation, you got to come with a little bit more stronger evidence than it's just because I'm Black. And it's 2022. I've sat in classes with other people at my same level who will say out their mouth that being Black is a risk factor for HIV.
Mm.
Things
Mm.
like that. It's kind of like, well, wait a minute. I don't know what book you read that in.
Right.
That's not true. And you're the same person that's going to go take care of somebody out in these streets and say the same exact thing to them, or test every Black patient that you have for HIV at every visit that they have because they're Black and they're at higher risk.
Mm.
That's not what that means.
Right.
And it's a a huge disconnect between what providers are doing for patients and what patients need done for them. And there's nobody talking about how to get everybody on the same level.
Mm. How many Black people are in your class? You know?
So I go to George Mason, and we are fortunate enough to be a very diverse university. You know, take what you want from predominantly white institutes versus HBCUs. You know, it is what it is. I I was born and raised in Northern Virginia, so I know what diversity is because I've grown through it. Even with a level of diversity in the Northern Virginia area, I still went to school even in middle school. I remember being in middle school and elementary school as the only Black child in that entire class. So I get it. To answer your question, there are probably 10 other Black students in my cohort. The and I don't want to make it like a but statement. With that, there's probably only three Black Americans, and they're all females in my cohort. The other students are either like African students that came
Mhm.
to the United States, and they've
Mhm.
been here for many years, so they're Black Americans, but they're not by birth Black Americans.
Right, right. Natural.
To make that
Natural.
distinguishing,
Yeah.
there it's a difference. There are
Right.
not a lot of people that grew up in places like me or look like me that are in positions that I'm in, where they're going to be somebody's provider or somebody's doctor. There's not that many. And that
Mhm.
was something else that was very intriguing. That's why I never stepped away from getting my FMP. I always want to keep being somebody's provider in my pocket because it matters for people if their provider looks like them or is aware of them or is knowledgeable about cultural things that are significant, like diet. We
Mhm.
have a huge issue around diabetes in our country.
Mhm.
And a lot of times you'll go to the doctor and they'll say, "Oh, you're pre-diabetic. Just keep an eye on your diet." What does that mean? What does that mean? Keep an eye on your diet. Are you telling people that they need to stop eating macaroni and cheese? Are you telling people that they can't eat white rice? You're telling people they can't eat bread? Like, you have to be more specific. But with that, you have to respect people's cultures. My mom is from Haiti. I've never had a meal that didn't have rice in it. Not one time have I had a meal without rice. Even at holidays, like even holidays that are traditionally like not with rice, there's no Caribbean person that I know that doesn't have rice in that meal. At some port somewhere on that table,
Mhm.
there's gonna be rice there. And it's gonna be gone at the end of the meal because traditionally that's just what we eat and how we eat. When we talk about diet for the general population, we have to respect what's traditionally acceptable and culturally made at their table. And if you tell somebody to watch their diet, you're not being specific enough to what they need to be mindful of. Because
Right.
yes, if you have diabetes and your blood sugar is 500, your provider might not want to tell you you need to stop eating macaroni and cheese. But I'm going to tell you, you got to stop eating macaroni and cheese because your blood sugar is 500. And a
Mhm.
lot of times it boils down to people just don't know. They don't know what my blood sugar is. They don't know what normal is. They don't know what to do with that. If
Yeah.
you tell me, watch my diet, I'm talking specifically about portion control. If you say that to somebody who's not in the same line of work, they think you mean, do I eat white bread or do I eat wheat bread?
Mhm.
They think, does that mean I eat 3 times a day or I eat 2 times a day? Or do I just need to eat one meal because I got too much sugar in my body?
Mhm.
There's not enough going into explaining to people what they really need to do and breaking it down because it's not the same for everybody. We are not all born with the same background and the same level of intelligence. So we need to break it down so that everybody understands what we mean when we say watch your diet.
Well
Or
said. No,
go
keep
ahead,
going. Go ahead. You keep going.
something like hypertension. To most people, that Black females are diagnosed with hypertension at significantly higher rates than every other nationality. And not only are we diagnosed with hypertension at higher rates, we are at much younger ages where we're diagnosed with something like hypertension. And hypertension is one of those things that we in the medical field know is called the silent killer because people don't realize that they have it and they're not doing anything about it. And because you don't feel your blood pressure is high, you're not going to pay attention to the things that are making your blood pressure high. And one of those things that science has told us makes your blood pressure high is stress. And there is not enough attention paid to how we manage stress. That is a learned behavior that most people do not spend the time learning how to do. And it's because who's supposed to teach you how to reduce your stress? If your doctor doesn't mention, hey, do you know how to meditate? What do you do to manage your stress? What type of coping skills you have? If your doctor's not having that conversation with you, who has that conversation with you?
Well said. I'm glad how you touched on a couple things: hypertension, diet. What does that mean? When the healthcare industry was, really established with group healthcare in 1974 under the care of Richard Nixon, it became more of a money grab when putting people in certain health networks and things like that. There's so much history with that, especially when it comes to Black people and our lack of care for self. And granted, there needs to be more diversity in the healthcare field. I understand, but in the Black community, there aren't many clinics outside of, like you said, this area is a wealth of information. Like 6 or 7 top 10 income families in the United States are in this area. Fairfax County is number one. You got Prince William County, Loudoun County, Stafford County. I mean, these are all top 10. A couple in Maryland, but we have access to resources like greater than any other region in the world. And the fact that there is a 7-year gap between two communities that's 1 mile in distance apart from each other is pretty unfortunate. And so you're speaking about the truth because you're there. You're right there in the battlefield, in the medical field, about clinics in Black communities. What can we do to turn the tide? We know that there is a challenge with hypertension as well as breast cancer among Black women. We know that exists. We're quick to put out barbecue dinners and all that kind of stuff on social media. But, I see a couple people once in a while showing that they exercise or do yoga, meditate. There's, like you said, no outlet. How can we change that mindset? How can we change the tide, particularly in the Black community, whether you're in the DMV or my hometown in Maywood or where Terry is in Iowa? How can we change the mindset amongst our people?
I think a lot of it, there's not but so much your community can do to bring providers to that area. At some point, the government has to step in and incentivize providers going to areas that are underrepresented. Like in our general Woodbridge area, we have like a huge shortage of providers to people who need care. There's something like 45 providers per 100,000 people in this general area. Like that doesn't seem right. There needs to be more providers that look like the people who are in their communities because it's a matter of trust. There's nothing a individual patient can bring a provider to their area. So at some point communities need to get involved and say, look, we want people that look like us. And that means you need to elect officials that are going to bring initiatives to your area that are going to be helpful to your population. Like it doesn't help our community if there's not going to be any reason why providers want to come here. Like, yes, healthcare is a business. It's unfortunate that healthcare is a business, but because healthcare is a business, providers aren't going to come to an area if there's no incentive to do that. And there should not be an incentive that's financial for people to want to be taken care of. That is like a basic need. Everybody basically needs to be taken care of. So there needs to be a relook at the way providers are paid to take care of people. That is a policy level change that the only way individuals can affect those type of level changes are for them to have an active voice in the democratic process, meaning that they have to vote. That is the one true thing that every individual can do that will make a difference in healthcare for the Black community, is that you need to vote for people that are going to bring that change that we want to see. There are 40.6 million Black people in the United States that are only identified as just Black. That doesn't count the millions of other Black people that identify as Black because they have one Black parent. 40.6 million Black people. That's 12% of our population.
Yes.
If every person in our racial identity group voted, that would make a difference. That would make a significant difference. And if we're talking about things like how are we really better to affect change, we're affecting change. And unfortunately, it goes back to having to have some trust in the government and in healthcare. Like, there's 1,050,000 drugs on the market, literally. The only way we know which ones work better in our people is for our people to be studied by these providers, by these big pharma companies, by healthcare in general, for you to answer surveys when people ask you to, for you to have an open dialogue with your provider about what's going on with your medication. Because we don't trust healthcare, we're not going to sign up for nobody's research study. I can guarantee you that. And that's unfortunate, because unless we're studied, we're not going to understand how they affect our body. Like, there used to be a time, and I remember when my mom was diagnosed with high blood pressure, she was like, I don't have high blood pressure. I'm just fine.
Mm-hmm.
She ended up going to a doctor who put her on multiple different medications to try to manage her blood pressure. She was on at 1.3 different medications to manage her blood pressure. Sometimes that's what it takes to manage your blood pressure, but people don't understand what it takes to manage blood pressure. Because she had to be on 3 different medications, they're working differently on different items in their body. It would be ideal if there was one medication that worked best for all Black people, but it just doesn't exist, because there's not enough Black people that we have studied to figure out how to make this medicine work in our bodies. And I'm not going to fault anybody who does not believe in giving themselves up to science. I totally understand. I'm not going to convince you otherwise. But that's one of the things that is a barrier to us having better medication for our people, is that nobody trusts enough to actually want to study medicines in Black people, because you're never going to get enough participants in your studies. And that's unfortunate.
It is unfortunate. I mean, there's a lot of opportunity for us to become more active and engaged. And, that's why I say it goes back to our mindset. We need to be able to not forget about what was done to us, but to be able to move forward in terms of taking action to prevent it from happening again. So, we don't want history to repeat itself, but we have to be proactive and being healthy, living healthy lives. One quick question as we prepare to wrap up. What does FNP stand for?
Family nurse practitioner.
Okay. All right. Thank you for sharing that. And again, just, again, I it trips me out when I see people like at the barbecue with plates about yay tall, with, with ribs and all that, and then drinking a Diet Coke.
Somebody in your comment section said it too, talk about health at the barbecue. Yes,
Yeah.
we should talk about health at the barbecue, but part of that means that somebody got to bring some vegetables to the barbecue. Like, my mom was Haitian. Like, she don't know how to make barbecued ribs. She doesn't make fried chicken. So when it's cookout time, I want to get down on some real black food. But I also brought Brussels sprouts to the last cookout that I went to, because we all can get down with the delicious meats, but we need some balance. And that's really what it is about. Nobody is telling anybody, or I would never tell anybody that came to see me about their diet, that they have to give up anything, but we need to incorporate moderation. And the reason why people have a hard time incorporating vegetables into their diet is because traditionally vegetables are not, the talk of the town, but that doesn't mean they can't be. There's a lot of things you can do to vegetables. Go find yourself an Indian friend and you will have the best vegetables of your life. But it's all about exposure. You really have to be in a situation, or somebody has to bring it to you in that way, so that you understand that, I don't actually hate vegetables. I love them. I just haven't had them this way.
Mm-hmm. Absolutely. Well said. So real quick question before we wrap up. I know I keep saying that, but this is very engaging. I love this. Our listeners need to hear this as well. We hope that those are listening, tuning in, are edified by this. But are we going to turn the corner as it relates to Black health, Latrice? Do you believe that what's happening with the advancement of medicine, with technology, and incremental efforts in trying to make our communities healthier, do you think that we are turning the corner in that regards?
I do. I honestly believe that there's a new generation of providers coming out that are going to change the way that we take care of ourselves. I think there's a newfound, COVID really shut things down for a lot of people for a long time. 3 years to be under a pandemic is a very long time. I think now people have a renewed sense of like what it is to be alive and actually have the ability to get back into the swing of things. I think people now have a newfound, desire to just be healthier. the more we know, the better we can be. And I think for many years, there was just a lack of information. Now there's a overwhelming amount of information. Deciphering what to do with it is really the challenge that most people have or should have at this point. But going forward, you have to do something with all this information that we have. We know that we can live longer, healthier, more vibrant lives if we do X, Y, and Z. Now we need to actually implement that. So I do believe that there is going to be a shift in how people take care of them. I think there needs to be an adjustment in how healthcare is paid for, so that people understand that, investing in your mental health may cost $150 per session, but that $150 per session is what's keeping you going to work every day so you can keep making money. That $150 session is what's keeping you from wanting to kill yourself. That is the end of your life. These sessions are a little bit of money. And yes, when I say a little bit of money, I don't mean to be dismissive of other people's financial struggles, but at the same time, $150 when Jordans cost $300, like, you gotta move your money to what's your priority. And healthcare really should be a priority for many people because it dictates so many things in your life.
Keeping it in perspective, that's what it's all about. And during the beginning of the pandemic, our family lost a really close friend. He passed away far too young. This was early, and we were praying that he would get through. He was only 45, I believe, when he passed away, and he just didn't believe that it was a serious thing. And then, before you know it, I mean, he took a turn for the worse, and we prayed that he was able to pull it through. But there were a lot of those who tell this type of story, and so here we are. As you said, 3 years later, are we out of the pandemic, Latrice, or do you think that it's still going to linger like pneumonia or the common cold?
I think so. When it comes to COVID-19, it's a virus. There's so many different viruses out there that we don't talk about that are still very prevalent. Flu has not gone anywhere. RSV has not gone anywhere, and they've been around for thousands of years. Maybe not thousands. They've been around for hundreds of years. Like, we know how to manage those viruses because we've studied them a lot. COVID-19 is becoming one of those viruses that we know more about because we're intentionally studying it more. So I don't think COVID-19 will forever be a problem, but COVID-19 came across in a time when we had the resources to really study what this does for people. And because we care, now we're going to monitor it for the next 25 years. So we'll be able to see what COVID-19 has in terms of long-term effects of people. Because of that, there's always going to be like that emphasis on COVID-19 because it's the first one that we've been able to study at this capacity. Mm-hmm. Because COVID-19 really did do a lot for the scientific community because it was the first time ever that everybody was working on one goal. Mm-hmm. And that one goal took less than 2 years to kind of put together. Do you know what I mean?
I do.
So COVID-19 is not going to go anywhere. It's unfortunately here to stay, just like influenza A and B are. It's one of those things that we need to just learn how to manage. But with that, it should highlight to people that, when COVID first came out, they told us that COVID lingered in the air, that it just was like hovering in the air, ready for everybody to just inhale readily. We know that that's not true now, but we know that doing things like wearing a mask if there are people around you that are coughing or washing your hands more often, we know those things work. And we have proof that they work. So it's not disputed. That's the good thing about all of this research. There are certain things that people are never going to be able to dispute as saying that this is what works to mitigate the spread of this virus.
Absolutely. Do you think that it will be implemented like annual shots, like flu shots? It'll be annual COVID shots?
So I personally don't think that there'll be like that annual need for a booster when it comes to COVID for people who are general healthy population, meaning you don't have any comorbidities, meaning you don't have hypertension that's uncontrolled, you don't have diabetes, you don't have high cholesterol. If you have no medical needs or imbalances, you probably are strong enough to fight any virus that your body may come in contact with. Yeah, you'll be under the table for a day or two, but you're not going to die from it. Those type of people, like if you don't want to get a flu shot, you don't really need to get a flu shot. But if you're around old people or babies, get a flu shot so that they won't get it and be worsely or even more affected by it than you would. That's why we get those type of vaccines. That's why people are encouraged to get the COVID vaccine so that we're not spreading it around so much. I think that if you have comorbidities, if you are somebody who has respiratory ailments or you're immunocompromised, you should most definitely be getting that COVID booster when they're telling you to be getting it. I think, you know, everybody got to take their chances. I'm not one that really does a lot to convince people that they have to get a vaccine or that they need to get a vaccine, because most people don't know. But if you're over the age of 65, you can get a pneumonia vaccine, but you only need that vaccine like once or twice in your lifetime over the age of 65. You know what I mean? Like, a lot of people just aren't aware that there are people who need these boosters every so often. And pneumonia is one of those things that after a certain age, you need to have that boosted a little bit more often. I think COVID-19 will become one of those type of vaccines that people of certain groups may need to be immunized against it more readily, because this is one of the harsher vaccines that we have. That's why we have a vaccine for the flu. That's why we have vaccines for pneumonia and various other childhood ailments that are no longer as traumatizing or as deadly as they used to be, because we have vaccines that fix those problems. With that, though, people still need to be mindful of why it's important to wash our hands. Like, we're all worried about COVID-19, but they don't talk as much about how there's like 5 or 6 different STIs that are now resistant to every antibiotic that we have, because nobody is addressing that. We need to have a conversation about STIs. Like, as somebody who's been in healthcare as long as I have, COVID-19, no doubt, is a very important situation that we need to be more mindful of. But there's a lot of other things that people are dying of a lot that we're not talking about as much, because we're only talking about COVID-19.
Right. I mean, we didn't even talk about, like different types of cancer. We mentioned breast cancer, but there's the other types. So yeah, I so appreciate you just breaking it down. And what is STI? I didn't catch that. What is that?
Sexually transmitted infections.
Infections. Okay. I heard STD, but STI. Okay.
Yeah.
But,
so back in the day, they used to call it STDs. They went away from calling it STDs because the disease is stigmatizing.
It's
so
a
it's
disease.
an illness because we can cure it. It's just an illness.
Okay. All right.
There are some that they're not cured and they still call them illnesses.
Yes.
I get it. Yeah, I know.
All right. But nonetheless, I digress. I want to thank you for taking time from your schedule. Again, we appreciate everything you're doing in this, demanding field, very challenging field. We thank you for your service and just breaking it down to a simple level that those of us who are in the medical field can understand. And so I want to give you the last couple minutes of this podcast to share closing thoughts and even words of wisdom for the audience. And the stage is yours.
Thank you. So I think my takeaway from my love of healthcare in general, which is not to say everybody doesn't feel this way, but for me at least, I think the biggest takeaway is that everybody needs to find a provider that they trust. I know that it's hard. I know that insurance may be a challenge to navigate, but you need to find a provider that you trust to have an open conversation about your health and how to optimize your health. And if you ever feel like somebody is not listening to what you're saying or you don't understand what they're saying, because that can be a big challenge in healthcare, is that most people don't understand what somebody said to them and they don't want to ask more questions. Ask the questions. That's what they're there for. Your provider is there to make sure that you walk out the door not asking Google or not asking your neighbor or not asking somebody who does not know. You need to ask the question to the appropriate people. And searching healthcare is a challenge. We all know that. You got to find somebody to help you out with navigating healthcare if that's what your dysfunction is, because it doesn't matter how many times you go to a different doctor for another opinion. If you don't understand the diagnosis, every opinion won't matter. So find somebody that you can trust in healthcare so that you can ask the right questions to the right person.
Very well said. And, we're probably going to talk off camera, Latrice. So stick around. And for those of you who did stick around for this podcast, we thank you for tuning in. As always, tune in with us every Monday at this time to Let's Talk DMV. I am Dr. Reggie Ratliff. On behalf of Terrence Hollingsworth and the team at Diversity Today Media, thank you. God bless you. Be safe and have a good night.